Good morning and thank you for joining us. I'm Yulia Rahimova, Digital Health Specialist for the USAID Healthy Mother, Healthy Baby activity. And today we'll be sharing about Healthy Mother, Healthy Baby digital transformation journey, which accelerated our team's use of digitized tools. We'll share how we designed a suite of different open source tools to digitize data capture by adopting DHIS2 CommCare platform. This transforms the way that data is captured at the community and facility levels. We'll also share how our dashboards are automatically updated in DHIS2 and how we use those dashboards to strengthen our analysis processes. This contributes to the improvement and decision making and adaptive program management for the Ministry of Health facilities as well as for our activity. Those gains help our activity to achieve improved maternal and child health outcome in Tajikistan. But first, I would like to give some background information about Tajikistan. To set the scene, Tajikistan lying in the heart of Central Asia bordered by four countries, including China and Afghanistan. Mountains occupy as much as 93% of the country and the population is a little more than 10 million people. Tajikistan has one of the highest rates of maternal and child mortality and staging, wasting, and underweight children in Central Asia, particularly in Hatlon province, where our USAID activity is active. Our activity's goal is to address those issues. Apt utilized an integrated approach driven by data use, continuous learning and adaptation, coordination, and targeted implementation. We use digital tools to improve maternal and child health outcomes. Given Tajikistan's limited level of digital literacy and limited infrastructure, our digital strategy was ambitious. In that, it shifted from trusted, familiar paper-based processes to tablet-based data capture and a digitally infused culture. Despite the odds, our team began capturing granular patient-based community and facility data on tablets using open-source software, CommCare, created by the Dimagi team. CommCare integrated with DHIS2-based apt monitoring and evaluation ecosystem, which we use for data management and visualization. DHIS2 is used by Tajikistan Ministry of Health and as their health management information system. And our team developed this ecosystem of open source apps that reach our target audience, pregnant women and new mothers, with tailored messaging, tracks training of thousands of unique community change agents, and instantly calculates facility assessment score. All this data flows directly to a server hosted at the Ministry of Health National Medical Statistics Department for analysis and to enable real-time decision-making. As part of Healthy Mother, Healthy Baby broader support to the Ministry and other healthcare stakeholders to build technical capacity, leadership, management, and policy reform potential, the activity developed 5 open-source maternal, newborn, and child health applications. The applications powered by the open-source software CommCare comprise a suite of tools designed to help healthcare workers and community leaders increase the quality of their service delivery. All apps are developed in accordance with national standards and protocols, and their sustainability will be ensured once they are all nationalized. Data flows directly into the DHIS2 platform and to a server at the Republican Center for Medical Statistics and Information, ensuring users have healthcare information at their fingertips to expedite decision-making. We digitized the World Health Organization's Rapid Health Facility Assessment during project startup and created an app. This application is used to access facilities and provide a balanced scorecard for maternal, newborn, and child health services. This assessment is over 2,200 questions, and previously this was paper-based and took 6 months from conducting the assessment to analysis. Thanks to digitized processes, the team conducted the assessment and completed analysis in a record 1 month. enabling us to redirect the time to improve supportive supervision. Mini version of this application was also developed that made it easier to conduct self-assessment. Partnering with the Tajikistan Ministry of Health and Social Protection of the Population, Healthy Mother, Healthy Baby led the digitalization of Tajikistan national MNCH and nutrition diagnostics, treatment and clinical protocols and guidelines. To systemize and expand clinical protocols and guidelines access, Healthy Mother, Healthy Baby created an online knowledge hub on the Ministry of Health website. Healthy Mother, Healthy Baby gathered paper-based clinical protocols and guidelines, provided capacity building to Ministry of Health web managers, and facilitated educational sessions and online webinars for nutrition resource centers in 12 districts and at the national level. The Knowledge Hub allows you to have quick access not only to national standards but to Health Security Net, UNICEF, WHO, and a lot of other global resources. In just 3 months, the number of site views was tripled and reached more than 25,000 views. As the official medical data at the national level is processed and stored on DHIS2, Ministry of Health is supportive of CommCare and DHIS2 integration. And as for data transparency and accessibility, Healthy Mother, Healthy Baby provided the Ministry of Health, in person of the Republican Center for Medical Statistics, with a local server where all activity-related data is stored on the DHIS2 platform. Healthy Mother, Healthy Baby has also been working with the Republican Center for Medical Statistics specialists to ensure they have the capabilities they need to utilize this data. For analysis, we are using the DHIS2-based out monitoring and evaluations ecosystem called EMI platform, which helps us to approach the management of mail data in a more standardized way and make it easier for projects to use their data. IMI includes tools that support routine mail data collection, data management, analytics, and visualization needs. Here is an important twist. Healthy Mother, Healthy Baby not only had automatically populated dashboards in EMI, but we also shared them with the Ministry of Health and even with our clients. And they celebrate this data transparency and are now using it as a standard. You might see by now that we implemented an ambitious digital strategy and we had to overcome some challenges. First, we need to make sure key stakeholders understood the digital strategy and why it was so important to try this new approach and how it would improve efficiency. We were also addressing Tajikistan's low digital literacy. Tajikistan has been underinvested in terms of mobile health interventions compared to other areas of the world. The country has limited digital infrastructure and internet. Digital processes for health were very new, and we realized that a behavior change process was to adopt digital tools. Given the limited digital literacy, the team needed to focus on basics first. We need to train users like community health workers and even some ministry workers on how to use a smartphone or tablet, how to download and update the application. Our ministry team members and even our own activity leads were experts in using familiar paper tools to track people and activities. And this was a huge behavior change to pivot from paper-based tools to digital tools. Certain processes still use a mix of paper and digital tools. For example, one of our applications, the Continuous Medical Education application, has paper-based journals with names and topics which participants write by hand. And this information is aggregated and entered into this application. While that uses a mix of paper and digital tools, the Rapid Health Facility Assessment was previously only paper-based and now is fully digitized. All assessments are conducted using a tablet. Scores are entered offline in the app and immediately scored and visualized. We frequently addressing the fear of losing data, the app not working, and build trust in digital processes. Users need to take a risk and use new, unfamiliar digital tools to capture critical data. They are mostly entering data offline in environment where there is no connectivity, and we need to make sure trainings and supportive supervision gain their trust in the tools and helps them understand that the data wouldn't be lost if they used tablet-based data capture. While there was initial skepticism of whether this ambitious digital strategy would work, the risk paid off. Ministry of Health workers and our team members alike recognized the power of those digital tools to facilitate their work. As a result, the team gained the precious commodity, time. Time to analyze results, time to dedicate to more supportive supervision or activities and continuous medical education. Throughout the journey, our digital strategy and dashboard served as a compass. We directed our newfound time to areas where most directly help to improve health outcomes of pregnant and new mothers and their children. Our team's conversation changed and become more focused on what the data was telling us, using automated dashboards that we built for our needs. Our shared dashboard with the ministry allows us to have deeper conversation at health facilities and with health providers, showing where we needed to focus efforts. We continue partnering closely with the ministry and they consider the Healthy Mother, Healthy Baby activity as a digital trailblazer, and our work has also revitalized the ministry's energy around Tajikistan national digital health strategy. Thank you for joining us, and I will give the floor to my colleague Namrata, a member of the DMAGI team.
Thanks, Yulia. And welcome, everyone. Thanks for joining me and my colleagues today to listen to our journey of bringing about a digital transformation in Tajikistan. My name is Namrata, and I work as a project manager out of DMAGI's New Delhi office in India. DMAGI is a global name in the digital health sector and is focused for helping organizations maximize the impact for their frontline workers with digital solutions for data collection and service delivery. We are the makers of the open source global good CommCare. We have also a large service delivery organization focused on collaborating deeply with our partners, leveraging user-centered design to make sure our technology is successful. We have worked on over 2,000 projects in 130 and more countries and have supported more than 1 million frontline workers who impact 400 million people. We are proud of the impact we've had to date and encouraged by the impact growth we continue to see as we work towards our vision as a world where everyone has access to frontline services they need to thrive. I have been with DMAGI for the past 4 years, during the course of which I've worked across different sectors and geographies, such as social behavioral change through chatbots in India, SMS adherence for TB patients in sub-Saharan Africa, and of course, the Healthy Mother, Healthy Baby activity in Tajikistan, about which I'm going to talk today. My colleague Yulia from Apt Associates just gave a wonderful outline of all that we're doing in the USAID-funded Healthy Mother, Healthy Baby activity, launched in October 2020, when COVID-19 was impacting our world deeply. Allow me to recap with you on our digital evolution on this project by looking at the different pillars we are working with. The first pillar is of service delivery and data collection. The healthcare workers constantly work with families in rural Tajikistan for maternal and child health indicators, as well as service delivery. We have digitalized the same into a robust maternal, nutrition, and child health application that is capable of tracking pregnant women from day 1 of their pregnancy till their childbirth, and tracking children from birth till the age of 5 years, along with providing state-specific counseling and recording essential information regarding the services they've received. We have also digitalized a survey for measuring the knowledge, access, and practices associated with WASH and nutrition-related topics to get a baseline of the current status that will be evaluated against a midline and an endline during the course of our application through the CAP survey application. The next pillar I'm going to talk about is the facility assessment. The application we've digitalized is the WHO RHFA tool that can be readily picked up for scale in other regions of the country if sufficient technical infrastructure through mobile phones is made available. This application enabled in record time availability of data for drawing inferences for the Katlan region and also contributed to the first ever facility in Tajikistan receiving a certification. The third and final pillar of the ecosystem that I'm going to talk about is of training and capacity building. We've designed the continuous medical education application, which is designed to enable trainers, facility managers, and the HMHB staff to track learning events and skill development, ranging from in-person trainings to workshops. The CME application is designed to make it easier for the Ministry Nutrition Resource Center trainers, who are the app users, to register and track the courses and trainings taken by healthcare workers. Since the app's launch in July 2021, over 6,000 healthcare workers have been registered and tracked on the application. All of these applications have been built using DHIS2 CommCare, which is an open source global good and is also integrated with DHIS2 for data visualization, again, an open source global good. The fact that I want to talk about today is how we leverage the principles for digital development in our design process. The Principles for Digital Development Forum outlines key living guidelines, as you can see on the screen, to establish the best practices in technology-enabled programs. These guidelines offer each phase of a project lifecycle, and they've contributed to HMHB's approach. These guidelines are also the foundation for USAID's Digital Health Vision for Action. While it might not be possible for me to cover how we've incorporated each of these principles into our process, I do want to talk about the three key ones, which are understanding the existing ecosystem, use open standards, open data, open source, and open innovation, and finally, design for scale. Understanding the existing ecosystem. This principle states how well-designed initiatives and digital tools consider the particular structures and needs that exist in a country, region, and community. At the start and throughout our journey so far, we have spent dedicated time and resources to analyze the ecosystem, the local context of Tajikistan and Katlan, to try and ensure that our tools will be relevant and sustainable and will not be duplicating existing efforts. We conducted an mHealth assessment study in the first quarter of our project in order to make an inventory of the past and current mHealth tools used in Tajikistan, so that we utilize the same to understand the digital health landscape of the country and to make recommendations regarding the use and rollout of mHealth tools for our activity. Based on our findings, we were able to become aware of the common challenges faced in the past by different digital activities, none of which have been able to so far achieve the scale HMHB activity has been. Our MNCH application alone in its first version has so far recorded over 10,000 events, and we have reached 157,000 people through the various social behavioral change campaigns conducted through the application within a single year. All our applications undergo thorough user testing, sometimes multiple rounds of it, and work with no internet connectivity given the lack of connectivity in Tajikistan. The second principle I'm going to speak about is around the use of CommCare and DHIS2 for our activities. Too often, scarce public and international development resources are spent investing in new software code, tools, data collection, content, innovation for sector-specific solutions that are locked away behind licensing fees, with data only used by and available to specific initiatives. Through our landscape assessment, we were able to conclude that CommCare and DHIS2, two of the world's most known and impactful digital solutions, will be very much applicable and pertinent to our geography for designing the solutions we have in mind. CommCare allows for building offline mobile tools and therefore allows for much wider reach in Tajikistan. The country's older HMIS was also based on DHIS2, and our integration with the same allows for continuity of solutions. In our project, we have developed so far the most advanced integration model we know of between these two solutions for seamless data collection and visualization. The third and final principle I want to talk about is that we are building from the thought of having the potential to scale in the future. Designing for scale means thinking beyond the pilot and making choices that will enable widespread adoption later, as well as determining what will be affordable and usable by the whole country or region, rather than just the pilot communities. One of the primary ways in which we wanted to achieve the scale was to be able to expand both horizontally and vertically through our applications. We therefore defined how each of our applications can in the future increase the gamut of services it offers. Let me give you an example. Our RHFA application was initially digitalized to consist of the entire WHO RHFA tool. This was easily adapted to become a much smaller tool for more routine assessment of facilities, in addition to the annual ones it was initially built for. We also define government buy-in as a primary indicator of our success and have been taking successful steps towards it, given the fact that we have actually been able to support their digitalization goals, more of which will be talked about in the next presentation of this panel. As I come towards the end of my presentation, I would like to mention that principles of digital development, all of which are excellent and critical advice, can leave us with the idea that there's a playbook for how to succeed in building new tech, that we've learned what works, that by reapplying those lessons, we should expect to succeed, that the new reason new technology is failing is because it doesn't heed to these lessons. I think the more credible reason any new piece of tech fails is far simpler. Most ideas for new technology just wouldn't work if you built it right. I therefore would like to ironically mention a fourth digital principle as a futuristic one to pay heed to. Our Healthy Mother, Healthy Baby activity has designed modular, interoperable tools that integrate and interact across different kinds of areas, such as service delivery, facility assessment, as well as training and capacity building. We are already a part of a technical working group in the country, and I would like to welcome the opportunity for the audience here to come and collaborate with us on the ideas that we can exchange, especially in case you're thinking of working or are already working in geographies similar to Tajikistan. I would now like to pass on the floor to my next colleague, Mr. Farman Hakimov, and I've also linked a case study of our project onto the slide deck that will be shared later. Thank you.
Добрый день, меня зовут Фарман Хакимов, я являюсь начальником отдела информации и анализа данных Республиканского центра медицинской статистики и информации Министерства здравоохранения и социальной защиты Республики Таджикистан.
Hi, my name is Farman Hakimov, the head of the Information and Data Analysis Department at the Republican Center for Medical Statistics and Information of the Ministry of Health and Social Protection of the Population of the Republic of Tajikistan.
Министерство здравоохранения и социальной защиты населения Республики Таджикистан в лице Республиканского центра медицинской статистики и информации имеет тесное сотрудничество с проектом USAID «Здоровая мама, здоровый ребенок» по внедрению новых информационных технологий и решению проблем в сфере здравоохранения для улучшения качества медицинских услуг, предоставляемых беременным женщинам и детям до 5 лет.
The Ministry of Health and Social Protection of Population in person of Republican Center for Medical Statistics and Information has close cooperation with the USAID Healthy Mother, Healthy Baby activity to introduce new information technologies to assist in solution of issues in providing quality health services to mothers and children.
С помощью проекта «Здоровая мама, здоровый ребенок» регулярно проводятся тренинговые сессии по наращиванию потенциала сотрудников, руководства Республиканского центра медстатистики и специалистов по информационным технологиям Министерства здравоохранения по использованию системы мониторинга и оценки АПТ для улучшения качества предоставляемых услуг и облегчения поиска информации для принятия решений.
With the support of the USAID Healthy Mother, Healthy Baby activity, series of capacity building training sessions have been provided for technical specialists of the Republican Center for Medical Statistics and Information and IT specialists of the Ministry of Health in using apt monitoring and evaluation ecosystem to improve the quality of health services and facilitate information search needed for decision making.
Проектом предоставлен сервер, который установлен на базе Республиканского центра медицинской статистики и информации для обеспечения бесперебойного получения и хранения данных для их дальнейшего анализа. Благодаря этому система CommCare может собирать данные и интегрировать непосредственно в DHIS2, которая с 2015 года является основным инструментом сбора и анализа данных для Республиканского центра медицинской статистики и информации.
In order to provide the Republican Center for Medical Statistics and Information, Healthy Mother, Healthy Baby first cooperated with the Republican Agency on Protecting State Secrets to get its approval and ensure installation of the local server at the Republican Center for Medical Statistics and Information. The CommCare system can then collect data directly into DHIS2 and transfer the data to a server at the Republican Center for Medical Statistics and Information. Healthy Mother, Healthy Baby regularly meets with the Republican Center for Medical Statistics to ensure the latter have the capabilities they need to harness this data.
Раньше было трудно анализировать обычные данные. Благодаря интеграции приложений для сбора данных с одной и той же системой. У нас есть постоянный онлайн доступ к данным и информационным панелям для проведения анализа и принятия необходимых решений.
Before, it was difficult to analyze routine data, but now we have apt monitoring and evaluation ecosystem which is DHIS2 based, and it allows us to content access to data and dashboards for analysis and decision making.
Укрепил знания IT-отдела Министерства здравоохранения в DHIS2 и CommCare. Это обеспечит возможность оказания технической поддержки сборщикам данных первого уровня, фасилитаторам, тренерам НРИС, врачам ПМСП и отделений больниц. Все цифровые инструменты, разработанные проектом, будут переданы Министерству здравоохранения. Устраивание информационных панелей проекта на официальном веб-сайте Министерства и обеспечение надлежащего отражения потока данных в соответствующем сервере Республиканского центра медицинской статистики.
Strengthen Ministry of Health and Social Protection of Population IT department their capacity in DHIS2 and CommCare and will ensure department is able to provide technical support to the first level data collectors like facilitators, NRC trainers, PHC and hospital healthcare workers. All digital tools developed by Healthy Mother, Healthy Baby will be handed over to the Ministry of Health. Enabling Healthy Mother, Healthy Baby data and dashboards in the official Ministry of Health website and ensure the data flows in the relevant website section is duly mirrored with the MedStat server.
Спасибо. Это был короткий презентация партнерства с проектом USAID «Здоровая мама, здоровый ребенок» и с Республиканским центром медицинской статистики и Министерством здравоохранения. Вопрос есть? Пожалуйста. Спасибо еще раз.
Thank you so much for joining our session. It was a brief presentation regarding Ministry of Health and Healthy Mother, Healthy Baby partnering to strengthen health service provider in Tajikistan. Please, if you have any question, let us know in the chat. Thank you. I see some questions into the chat, and thank you to my colleagues that answering it. But I want to speak more about this question. So, do you have any challenging of using DHIS2 in your country? And so, DHIS2 is preferred system for Ministry of Health, as our colleague mentioned about this, and it is quite easy to make sure that Ministry of Health have all the information about all our application. As I mentioned, Healthy Mother, Healthy Baby have 5 CommCare based application into DHIS2. And all data is migrated to the server based on the Ministry of Health IT department, and they have all information for decision making.
I can add a little bit on the interoperability between the other systems. So we have actually spent quite a bit of effort just to ensure that the different kinds of data that is being collected through CommCare goes seamlessly into DHIS2. One of the things that we have done, and which also speaks to the digital principle I spoke about, is just ensuring that our design knows what the end output is going to look like. So we go through thorough evaluation with the ministry and with the technical team on how they would like to see the data, and therefore build a data model that collects that data in such format so that it seamlessly moves and can also be transformed on the DHIS2 visualization dashboards. I see. I see you've asked what's coming next. I suppose it's with the project reference. I think one of the things that we are thinking about is just ensuring that we cover more digital services in the MNCH application. And given we've entered our 3rd year of the project, we will be working towards ensuring that we build a more thorough and robust practice of having data-informed choices and decision-making at all levels. We regularly use data at our level and also collaborate with the ministry, just so that they're also informed on how services are being delivered, what is the nutritional status. And the idea is just to ensure that we're doing all this effort actually translates into something that's valuable and important for the ministry and generally the country to improve the different health indicators.
And thank you so much for joining our session. It was very exciting to share more about Tajikistan from different side of views. So thank you so much for joining.